Heart disease is the #1 cause of death in the United States. 47% of Americans are at risk, and one of our associate producers just found out she is now one of them.
My name is Lisa. I'm 48 years old, and I have a long family history of heart issues. My uncle died of heart disease when he was only 33. My father died of a heart attack when he was 54. And at 67, my mom died of a massive heart attack. I thought I was in the clear because I have never had high blood pressure or high cholesterol levels. I also don't eat red meat and have never smoked or drank much alcohol. But I recently found out that I do have buildup in one of my arteries. I now want to keep my other arteries as healthy as possible.
Well, Lisa, welcome, and you are not alone. You know, many people are concerned with their heart health, and coronary artery disease is the most common type of heart disease in the United States. Cardiologist Dr. Joel Kahn also joins us. Welcome.
Thank you. Thank you. Thank you.
So, Dr. Kahn, what advice do you have for Lisa and the rest of our viewers?
Well, whether you have a family history of heart disease like Lisa or not, everyone should be thinking about their heart health.
And Lisa, here's what may be happening inside your body. Cholesterol, which is a fluffy, waxy substance, can attach to the wall of blood vessels. Calcium can then attach to the cholesterol, creating a hard shell. And this cycle can continue, which is not good for your heart health. So, Lisa, did you know that calcium buildup could affect your heart health?
Well, not before going to the doctor. I had always thought of calcium as being good for your teeth and your bones only.
Well, you know, calcium assists with many processes in the body. It's also vital for electrolyte production and muscle function. But it can be difficult for our body to transport.
Well, that's right, actually. What we want for optimal health is calcium being directed away from our arteries. We want calcium working for our health, not against our body's wellness.
Well, Lisa, you're doing the right things, researching and learning how to keep your heart healthy. So watch out for pressure or tightness in the chest, shortness of breath, pain in the shoulder or arm, and sometimes sweating. If any of these symptoms occur, make sure you get help immediately from a doctor. And Dr. Kahn, what else would you advise for those at home that are watching?
Yeah, well, if there's any warning signs or any family history of heart disease like Lisa had, ask your doctor for a calcium score test or scan, which shows the buildup of calcium in the arteries. Then the doctors can make a treatment plan just for you based on the results.
Got it. So, Lisa, do you have any questions for the cardiologist while we have them?
I do actually. What can I do now to be more proactive about my health?
Yeah, well, research studies show that vitamin K2 can help direct that calcium away from your arteries and, in fact, direct it towards your bones, which is where you want it. So you actually end up with better artery flexibility and better bone density.
You know, and one way to get vitamin K2 is from high-fat dairy products, egg yolks, liver, and other organ meats, or fermented food like sauerkraut. So, Lisa, do you think you have vitamin K2 in your diet?
I'm gonna say probably not because I don't really care for a lot of the foods that you just mentioned.
Well, Lisa, you're not alone in that. A lot of people avoid those foods, and in fact, in general, the Western diet is actually not adequate to supply all the vitamin K2 we may need. And that is why it's rather essential to consider a daily dietary supplement of vitamin K2. That's why I partner with Weider Artery Health on their line of heart health supplements. They use a patented form of vitamin K2, the one most used in clinical research trials. It gets down to taking 1 pill a day, but of course, that supplement is only part of an overall heart healthy program you and others need to follow.
Sounds good. Thank you for the advice.
And remember to always consult your doctor before taking any supplements. And since these are available at Costco, we're giving you and our entire audience a $50 Costco gift card. Lisa, thank you so much for coming today. Lisa and Dr. Kahn, as always, a pleasure to have you here.